developing some processes or even thinking about some use of data and mapping. So I'm excited to share that with you all today. And then I have Wido with me, so I'll let him introduce himself.
Yeah, good morning, everyone. Wido Canales. I am also here on the Denver team. I am also one of the analysts here. Today I'm just kind of here supporting Bianca and let her take the lead on sharing some of the work we've been doing.
Perfect. Thank you, Denver, for introducing yourself. Wido does the work in Denver, the smoke-free multi-unit housing. Bianca did do the work in Denver. Denver's kind of like all you guys. It's like so-and-so did the work, but now they're doing this work, and now we got the new person doing the work. So we're constantly training and teaching people, right? All right, well, let's start with the group. Angelo, would you like to start us out with an introduction?
Sure. My name's Angelo Grigo. I'm with the Otero County Health Department. Actually, I'm also with the Southeast Region Tobacco Initiative. We service 7 counties down here in Southeast Colorado.
Perfect. I do have a icebreaker. Would you put the icebreaker question, Bianca, in the chat? It is, what is your experience with data storytelling? So that could be anywhere from collecting. I'm familiar with collecting data. I'm familiar with putting pins on a map, or I'm an expert and can do GIS mapping. So let's say beginner, intermediate, or advanced. Angela, where would you lay yourself in that, in storytelling through data?
I guess intermediate, maybe, I guess.
That works. If you've been part of a GIS mapping project, or you've been part of a data collection storytelling, that'll put you in intermediate. If you've done all the work yourself, that puts you in the advanced. Okay, so nice to meet you and welcome. I don't think I've had you at our meeting before, so I welcome you for the first time. Adrian Hollins, would you like to go next?
Sorry, Peggy, I just jumped on. Teams wasn't letting me in. What's the question? I apologize.
Okay. Yeah, no, that's okay. I'm going down my list, and sadly, it always says the last person that enters on the top. We're talking about data storytelling. So what is your experience with data storytelling? Are you a beginner? Are you intermediate? Or are you advanced? Like, have you done a GIS mapping project, or are you just beginning with this work?
I would say somewhere in the middle.
Intermediate.
Yeah.
Perfect. We just want to know what level to speak at with you guys today.
Okay.
Perfect. Okay. How about Ashley?
Hi, I'm Ashley. I'm a community health educator with Douglas County Health Department. I'm in between beginner and intermediate.
I want to caveat, I'm beginner. And I don't want to advance past that. So no, I'm kidding. I am a beginner. So don't feel bad saying, yeah, this is all new to me. That's very, very understanding. Brianna?
Hi, I'm Brianna with the Northeast Colorado Health Department. I would say I'm a beginner because I'm still pretty new to this.
Perfect. Welcome. Join me as we learn.
Thank you.
Chelsea Martinez.
Hi, I am with Rio Grande County Public Health. I would say, I guess I'll be bold and say intermediate, because I've used it for a couple mini grant applications and helping with other grant applications. So
perfect. Thank you, Chelsea. Colleen.
Can you hear me?
Yes.
Okay. Hi, I'm Colleen. I'm with Routt County Public Health. I am very new to this, so I am here just to learn from you all who have done it.
Welcome. And I'm sorry, what county were you from?
Routt County.
Okay. Have you been to our learning community call before?
I don't think so. I just went full-time in January, so now I can go to stuff on Wednesdays because I didn't work Wednesdays before, so I don't think.
Wonderful. Welcome to the group.
Thank you so much.
Daylene.
Hi, I'm Daylene Colglaze from Kit Carson County, and I would say for a beginner for data collection and all that good stuff that we're going to talk about today.
Perfect. Hey, Alberto.
Hi, good morning. I would say I am intermediate as well.
And Alberto, who are you with?
Oh, I am with Boulder County Public Health.
Great. I know you, but I want the group to know you. And Pete, would you like to go next?
Sure. My name's Pete Bialik, and I'm with the group to alleviate smoking pollution, Gas Colorado's subcontractor with Denver Public Health and Environment. And I guess in terms of what we call storytelling, I've been doing it a long time, so pretty good at it.
Pretty good at it. And we'll follow up on Pete later. He's the source of some data that you'll want to have hold of after you review this presentation. Hazel, good morning. Would you like to introduce yourself?
Yes, good morning. I'm Hazel Statkevich. I'm with the Arapahoe County Public Health. I'm a community engagement specialist on the tobacco team.
Perfect. Thank you.
I'm definitely a beginner.
Be proud. We're learners. Angie, I don't know. I know you're in a meeting. Are you auditing this? Or are you participating?
I mean, I'm here for whatever you like, Peggy. I can participate.
Oh, good. I didn't know if you were in a meeting. I thought you were in a.
I was.
Okay.
I actually got permission to miss the other one, so I could be here with you all today.
Yay! Introduce yourself.
Hi, everyone. I'm Angie Kagosik, and I'm the Tobacco Program Supervisor here at Denver Department of Public Health and Environment. I'll say I'm a beginner. I'm learning from my team more than just along with the rest of you. So.
Thanks, Angie.
Sure.
Lucy Luna.
Hi, Peggy. I would say that I am a beginner as well because I haven't done any, but I know our department has, and I've seen some of the work they've done. But for me personally, I have not dug into any of it.
Perfect. You'll fit right in. Michael Salzar. Michael, are you with us today?
Yes, sorry, I was having a difficult time getting my mic to unmute. Michael Salazar, Otero County here in southeastern Colorado, and I am very much a beginner to this, but very excited to learn.
Now, Michael, is this your first learning community call for the smoke-free multi-unit housing?
It is, yes.
Yeah, I'm not familiar with your name, so welcome. Glad to have you here. Michelle.
Hi, I'm Michelle Grigo, also with Otero County Health Department Tobacco Program, and we serve 9 counties in southeast Colorado.
Perfect. Anli.
Here we go. Hi, I'm Annalie Kravig with Lincoln County Public Health, and I would say I'm a beginner.
Perfect. Now, that's everyone on my list. Have I missed anyone? Would you want to jump in and introduce yourself if I missed you? Okay, hearing none, I'm going to now turn the presentation over to Bianca. I do want to caveat this, guys. I'm going to put you in the right headspace before we start, because I don't want you leaving here going like, "What was that?" Because this is after 7 years of data collection. Okay, Denver's been doing this work from the beginning, so they had a whole bunch of data that they could collect from. You probably will not have that level of data, but we want to put you on the right path to understand early on, what questions should I be asking? What data should I be collecting? And how am I going to use this? My number one pet peeve of public health is that we just collect data and surveys, and then what are we going to do with it, right? So we want to have an intent to what we're going to do with our process, but we want to make sure that we have something to show of our work. So that's what this is about today. And again, we're just learning, and we'll do some breakout rooms and get some hands-on this. So don't feel like like you're behind or don't feel like, oh my goodness, we got to do this, because you don't. We just want to show you the future. Okay. So with that in mind, I'm going to now mute myself and let Bianca take control. Bianca and Wido. And please, if you have questions, jump in at the time. We don't mind if you jump in at the time. If you don't want to save it till later. Bye.
Yeah. Thank you, Peggy. Appreciate that kind of level setting, and definitely agree with Peggy. Please jump in as you have questions. I think this is meant to be more of just kind of a walkthrough of our experience here in Denver. And once again, I'm Bianca Garcia. I've been with the team for almost 2 years now. Exciting. Time flies. Before this, I was in Kansas City, and so I primarily worked on cessation and prevention work with youth. So secondhand smoke work has been completely new to me. And I think even though we kind of talked about, are you a beginner? Are you intermediate? I think it's important to think, even as you go through a process like this, you might start off feeling like a beginner and you start to learn a little bit more, where you feel a little bit more like, okay, I'm starting to get into that intermediate area. And so I still feel like a beginner, especially when we're working with our GIS administrator person who knows way more than we do. I definitely rely on them and have them kind of guide us through the process. So we don't want you to feel like this is something that is out of the question for you. I have a couple of alternatives to kind of start the process, so we'll work through that. But thank you for being with us today, and please feel free to stop us if you have any questions. So here are just some of the objectives that I wanted to cover. And like I mentioned, Wido introduced himself earlier. So Wido and I went through this process together. It was a learning process for sure. And I know I leaned on him for some big decisions, and it was really helpful to kind of tackle it as a team. We always took decisions back to the tobacco team as a whole as well. So it's definitely not one thing. It's not something a person can do on their own, is more of what I'm kind of getting at. But at the last LCC, I know Peggy talked about the importance of collecting data, which elements to focus on. And so now we're kind of transitioning from that data collection to more of the data utilization. So in that storytelling approach, right? And then through this LCC, we really want to explore some potential mapping tools, and GIS is one of those, but it doesn't have to be the only one, right? So we'll talk about that. And then also what kind of impact this could have on secondhand smoke outreach. And so we'll share kind of what our ideas are in developing and using the map, and maybe that'll kind of trigger some ideas and see if anything works and kind of aligns with what you're looking at your setting. So like I said, transitioning from data collection to data utilization. In the last LCC, we spent a lot of time talking about how data can really serve as a foundation for just kind of this process of starting to understand what the purpose is for collecting data, right? To get a better understanding of what's happening in your community. And then we also discussed some common data elements to start collecting. And so this could be property type. So if it's HOA, public housing, private, like market rate, whether or not properties have the presence of a smoke-free policy. So that's something that we didn't think about right away, but we added on later. So we figured that was important to kind of start tracking, especially with our outreach work. And then demographic information. A lot of our cases are tracked through Salesforce, so we just kind of collect that information already. So it's something that, it could be collected, it could be helpful, it might not, if you're trying to keep the cases anonymous. So definitely something to think about. You may want to track the source of complaints. So through Salesforce, we get cases from the state, we get cases through 311 complaints, and then we also get online submissions. So that may be something you'll want to track. Also, how often you're getting the case from a specific constituent. That might be worth tracking as well. So just kind of think about those pieces. Think about zip code versus council district. Here in Denver, a lot of the work we do is very specific to council districts, especially if we're thinking about advocacy long-term. So we try to kind of bind things by council district, and that makes sense for our county, but whatever works for you, if that's zip codes, that would be something to start tracking. And then something we've recently started doing is qualitative data. So in Salesforce, we'll add case comments into our cases. And so that's something we've started reviewing. Is there anything here that can kind of inform our next steps? Are we starting to see kind of a standardized approach to our work that we can start documenting? So all of that is in our kind of like qualitative, like our comment section. And so something Peggy and I talked about as we were preparing this presentation is that we understand some of these data elements may not be easily available. Like Peggy mentioned, Denver has been collecting data for quite a few years, so it may not be something that you are able to tap into right away, or you may have to tap into community partners to get that data. And so Peggy mentioned that gas, for example, is a good resource. So we did work with Pete to get some smoke-free policy data from him, and so that was really helpful with our map. So I'll show you kind of how that factored in, but those are just a few things to kind of keep in mind. And we'll move into the next slide here. And so again, the transition from data collection to then interpreting that data and then utilizing that data can look very different. It can be used across different ways as well. So if you're wanting to adopt a policy at the city level or the county level, or even working with housing providers, right, with their enforcement if they've got a current policy. If you want to inform your programming and strategic outreach efforts, I think mapping is really good for that because you kind of get a feel for where in the county are you seeing more of an issue, and are there other factors that can kind of play into that? So is there a reason why there's a concentration of cases in this specific part of the county, right? So really mapping that data can help you move beyond the spreadsheets of if you're tracking this in Excel or through Salesforce, right? And putting it into a visual picture that really tells more of a story, not only for you to kind of guide your outreach, but also for policymakers or community stakeholders that you want to tap into, right? So the goal isn't just to develop the map, but what will you do with that map? And so, like I said, it can kind of help with hotspots. It can help determine if there are any other social determinants at play and start to really focus on more of a targeted intervention. So here are two mapping tools that we've kind of played with around as a team. And I think that the one that we've alluded to is the geographic information system. But as we've been developing this presentation and also the work with the GIS map, we've realized Google My Maps is also an option that can be used. So this Google My Maps is actually a free kind of program online through Google. And it's, I think, a really good kind of starter tool, especially if you're just wanting to like play around with a couple sample cases and you want to plot some addresses or zip codes. With Google My Maps, this can be single or multi-layered. So I'll kind of show the difference between those two on the next slide. And then with the geographic information system, the GIS, this is, I'd say, a bit more technical. And like I said, we leaned on our administrator a lot for this. We didn't do any of the behind the scenes development. We really just kind of informed which layers we wanted to be a part of the process. We shared the data we wanted to be included, but we didn't actually do like the development of the map for the GIS approach. With Google My Maps, you can have a little more control of developing the map. So that's kind of a nice thing. Typically with the GIS maps, these are multi-layered. So you've got a few different layers to kind of help inform what the map will be. And I know it's a little muddy because you haven't seen a visual of it, but we'll move into some of those visual slides and hopefully that gives you a better idea between the two. But I do think that with the GIS map, it allows you to get a little more granular on the data and how you want to use that data. So that is something to consider if you've got an EPI team you can rely on, maybe who currently uses this system, or if this is something that you can advocate for at your health department or your county to start to utilize a little bit more. So here are two screenshots of two different Google Maps. So the one on the left is a single layer map. And so this literally just shows, I think I uploaded 10 cases, secondhand smoke cases within Denver. So just example cases. And then the one on the right, we would consider a multi-layer because this not only has those same cases mapped, but it also has the boundary of the county. So that would be the second layer, is the county boundary. So that's kind of nice because then you can visualize, okay, where exactly in the county am I seeing these concentration of cases, right? It's not just a blanket one layer map. I think it's just a little easier to interpret. So when we're talking about data storytelling, I think the one on the right really says a lot more than the single layer. So both of these you can develop in Google My Maps. So like I said, it can be single or multi. It's just kind of how you want to build it out. So this next slide, I will just show a video that I did, just a clip of how to develop a Google My Map. So don't feel like you have to take notes or screenshots at this point. Peggy will upload a recording of this. So if you need to reference this as you're starting to play around with Google My Maps, feel free to refer back to this. But Google My Maps is available through Google. The only way I know how to access it is I just go to Google and I type in Google My Map. You do have to be logged into your Google account or create one, and it will show you kind of across the top there maps you own, maps that you've maybe come across that is like a public map. It'll kind of save it for you in your library. But when you go to create a new map, you'll just hit that button at the top. And so here I'm titling example secondhand smoke case map. And once you name it, you don't have to give it a description. It can just be the name of the map, especially if you're just playing around with it. So first I'll show kind of how you import some cases. So this will just be a single layer map. And so I'm giving the layer a name there. And when you go to import, you'll want to have these files somewhere where you can easily access. So in this case, I think I had it on my desktop, but it can be in your downloads in a folder, just as long as you know where you're pulling this from. So this could either be the Excel you're already collecting data in. It could be an Excel that you've downloaded from your data collection system, like we have Salesforce. So here I have the same sample data that I'm pulling from. And again, this was like 10 cases that I had put together just for the purpose of this video. So once it uploads, it shows you all the data columns you have in that Excel. So in this example, I only have 4. You'll want to tell it to use the street and the postal code as kind of where the marker will go. And then the case number can be the name of the marker, right? So it's up to you if you want it to be like the actual case number. I think I just numbered it 1 through 10, then you can change that. But you'll want that to be kind of the identifier. So when it uploads it in here, it is kind of harder to see, I think, because it makes it blue. It kind of blends into the background. So you can modify that in Google My Maps. You can change the color, you can change the icon. And so here I'm just kind of walking through what it's like to change the icon. And I specifically picked out the cigarette just because I thought, it was very fitting, but you can make that icon anything you want, especially if this is going to be a private map that you're not sharing. So again, I changed the color just because it helps stand out a little bit more. And there you can kind of see with these sample cases I uploaded here, you can kind of see some concentration going on, especially closer to downtown. And so I think this is helpful. It's a good place to start, but it would be even more helpful if it had that second layer of the county outline. And you can upload other layers as well. I know we recently had a training from STEP for the track dashboard, the tobacco retailer licenses. So there, I actually played around with that website, and you can download tobacco retail licenses for your county from their website. And so you can get that data as well and upload that as another layer. And so you could compare your cases, how they're mapping out compared to those retail licenses, right? So that's another layer that you could potentially add to this. So in the second piece here, I'll walk through adding that county map. So this is a county map that I came across. I'm not actually sure who put it together, but it's really helpful because it's already kind of it already has those boundaries built into there. And so this is just showing, you make a copy of that map. We can share the link to this county map if that's something you want to play around with. So making a copy of that map automatically applies that county layer to it. And then you'll go through the same process of adding a new layer, which are your cases. So this is kind of good practice because it'll go through that process again. So you import that new layer with your cases, give it whatever name you want, import that data that I mentioned. You'll want to know where that's located on your computer. It'll upload the data columns. And then again, you want to let it know to use the street and the zip code as where to put the markers, and then the case number as the marker identifier. So it automatically reverts to this blue marker, which is, I think, annoying, but you can change it again to red and then change the icon as well. So that's kind of what I walk through the rest of this video. But that is kind of a walkthrough on how to use Google My Maps. I think it's a really good starting point, especially if you're not familiar with GIS. Maybe your health department doesn't do a lot with GIS. This could be a starting point, and you can make it multi-layered. Like I said, you could use the county layer on top of your cases. You could add in data if you work with local partners such as Pete to get some of those properties without smoke-free policies near you, right? You can add that as another layer. You could add tobacco retailers as another layer. So there's a lot of different functionality approaches that you can take, right? But that basically is just showing all the counties here are included in Colorado, and it just gives you a better visual. But that is the walkthrough of Google My Maps, and then we will move on to the next slide. And then Peggy and Wido, please let me know if there are any questions that come up in the chat, and I can stop and answer those.
Bianca, yeah. I don't see any questions in the chat, but I just wanted to highlight something you said about adding the retailers and why would we, you know, like, I want them to understand like why you would add a retailer, because if, you know, if you have a case where there's a hot spot, you could maybe associate that with the amount of tobacco access in the area. So that's the storytelling, right? When you do that. So just wanting you to understand that little part.
Yeah, no, thanks, Peggy. Yeah, and that's kind of the thinking behind this is like, are there other factors, other social determinants that could be at play, right? That could explain why we're seeing hotspots. It's probably an interaction of all of that. And so as you're starting to kind of explore different layers, it's just helpful to start thinking about that more like this general sense of what is happening in the community. So we'll go ahead and move into the GIS map. And like we've mentioned with this map, it's kind of been, I think, a long time coming as a team. The team has been collecting a lot of data probably since 2022, when it really was starting to get documented. And so for this map, we really did have a pretty large data set to work with, probably over 200 cases. And just last year alone, we had almost 100 cases that we could pull in. So it's definitely pulling in from the last few years. And like I mentioned, we worked with our GIS data administrator to develop this. So the technical pieces, Wido and I really don't know how that was done. That was all behind the scenes. We really just worked with our administrator to really determine which layers we wanted to work into the map to upload the data, similar to what we did with the Google My Maps. But it was all our GIS administrator who kind of put this together. But for the walkthrough of this one, I'll show more of the utilization and less of the build out, since we didn't really help with that. But before I get to that point, I wanted to talk a little bit more about the layers and why we picked those. So this table really describes which layers we included in our GIS map and also the progression of the layer selection. So the different colors, I know it's kind of hard to see, but the different colors show which ones we picked at which point and for what reason. So we ended up starting with the secondhand smoke case data, the tobacco retail license data, and the Denver City Council district data. And that was really, I wouldn't even say data, but just the district outline, right? The reason we picked those three is because we were already kind of tracking the districts with our secondhand smoke cases. So we knew which district these cases were occurring. But with the tobacco retail license, we work with our compliance and enforcement team. And so they have a layer currently in GIS that they update annually of tobacco retailers. And this is more public facing so that tobacco retailers can go on and see how close they are to a school, make sure that they meet those requirements before they apply for a license. But we can kind of recycle some of that same data to show where the current licensed retailers are, right? So we wanted to overlap those and start there. The council districts, like I mentioned, for future advocacy efforts, it's kind of good to know which counties we're seeing hotspots in. After we explored those layers with our GIS administrator, we thought about, we took this back to the tobacco team and we had larger conversations about, well, are there other policies or other layers that we're missing? How do we get our hands on other data, right? And so that's where we started to think about local partners. And so we met with Pete and kind of shared with him what we were thinking. And we really wanted to incorporate properties without smoke-free policies. And so I think we landed on the without, just because we do want our outreach to really be targeting those properties that don't currently have a smoke-free policy and are in those hotspots, right? And so that was something we were able to get from GAS through that partnership, right? And so it was really helpful in incorporating that with our GIS overall, right? And then finally, the last 3 layers here: air quality, CDC's social vulnerability index, the SVI, and then Denver affordable housing dashboard. These were 3 other layers that we felt like potentially could interact with what's happening in the community. So when thinking about social determinants of health, is there a double burden of exposure, right, that residents, tenants are experiencing if their air quality outside is bad, but then they're also experiencing exposure indoors, right? There could be that double burden issue. And so this layer really gives real-time air quality data for monitoring sites across the county. And so we used I think it's the federal layer for that one, the EPA's. For the CDC's social vulnerability index, this is really just to get an idea of what socioeconomic and demographic factors there are for communities. And so the way that the layer is outlined, it kind of gives a scale. So the higher the number, the more vulnerable that community, that neighborhood is. And so I think this just kind of helps us understand the way that we're prioritizing, where we're seeing hotspots. It's really based off of the locations that align with STEP's priority populations. It makes sense for us to invest more time, resources in that area, right, because of what we're seeing. And then finally, the affordable housing dashboard, it was really just one we wanted to add on just to get a sense for how we're seeing housing developments across Denver. And so I'll show you what this looks like in the map, but this really just tracks projects and identifies opportunities for additional smoke-free initiatives. But now those are the layers that we landed on. Feel free to refer back to this if you have questions, but if you have questions and want to raise those now, we can also answer them as well. But I will go ahead and share the walkthrough of that GIS map. And like I said, this is less of the build out and more the utilization of the map. So all of those layers I just went through are on the right-hand side. So you can see that those layers can be toggled on and off. So you don't have to look at the map with all of those layers at the same time, because as you'll see, once I add an address in here, it can get a little overwhelming. So it should, yeah, this video takes a little bit to play. It should start showing here. So I think here I'm just showing what it looks like if you toggle these on and off. It doesn't do a whole lot before you plug in an address. And the way that Wido and I have been discussing ideas on how we want to apply this is really using it as a way to enter the address, do a 1 mile radius search, and then see what it populates for that radius around the case. And so as we get cases in, we plan to plug in the address, do the search, and then it'll give us that information for all of these layers. So here I'm showing just a sample address. And then, like I said, it's automatically populated to a 1 mile radius, but that can be customized. And so it shows the map zooming into that 1 mile radius from that address. And so you can see now there's more information here on the right-hand side for those layers. So the air quality, like I mentioned, this is based off air quality sites. So there aren't monitoring sites near every case, but sometimes it's not relevant data. So as you can see there, it's in the green. So it's not super concerning as far as air quality, and those do change as those numbers get updated. Affordable housing is the one I mentioned about projects and just kind of getting a feel for like what's currently in the area, whether it's rental or sale. Secondhand smoke, multi-unit housing case data, that's the layer that we provided our GIS administrator with of cases that we pulled from Salesforce. So it's a heat map. The colder, cooler looking the color, the least amount of cases, and the warmer it is, the more concentration of cases. And then we've got 2 icons for tobacco retailers, and then the one for housing without smoke-free policy is that purple kind of home-looking icon. But you can see I zoomed out for the city council district, and so this case is specifically in the city council district 7. And then there's the SVI, so you can see the coloring differences, and it shows the scale. And so that's what the layers look like after you've put in an address. And on the left-hand side, it gives frequency, so it gives counts for all of the affordable housing properties within that 1 mile. It gives counts for the number of cases within that 1 mile. And so you can kind of see that all the way down. Tobacco retail licenses, the number of smoke-free properties without smoke-free policies. And then I wanted to show what affordable housing looks like by itself, because it's kind of hard to see with all the other icons in there. But basically, it's just if it's rental or sale, it'll be a blue or yellow circle. And then the size of the circle is how many units are in that property. So all of these blue ones are probably within that 100 unit classification. And so here I put everything back on, and it's chaotic, as you can see. But I want to show the left-hand side here a bit more, because here, like I said, it gives counts. And then the cool thing that our administrator did for us as well is pull in the names of those housing properties, the case numbers, and the names of retailers, and then also the distance in terms of miles. So all of that information is available for us if we want to really explore that at that level of detail. And that's kind of what I meant about the granular detail, right, that you may not get with Google My Maps. But like I said, Google My Maps is a really good starting point. This is just taking that kind of and working with the layers a bit more to try to get a better understanding at that granular level. And so here I'm showing the scale of the SBI. And so this one falls at that 0.59. So it's not close to 1, but it's a little higher than probably what we would consider a low priority case. And like I mentioned, you can adjust the radius. So here I'm changing it to 0.5 mile, and you can see those numbers maybe a little bit easier to work with versus 100 plus properties without smoke-free policy. So that's something
Bianca,
yeah.
I have a question. So going down to the SVI, because I think that's an important layer of the social vulnerability index. Could you kind of just explain the value, what it means? You said it's not quite a 1. Is 1 a high?
Yeah. So I rewinded it a little bit so you could see that scale again. So the higher the number, the more vulnerable that community, that neighborhood is deemed to be based off CDC's SBI index. And so it takes into account a lot of socioeconomic factors. And so that's how it gets at that ranking, really. And so this one, I think, is at a 0.59 or 59, it says on the left here. So it would fall in that second tier. And I think our thinking in including this was that we wanted to just have some way of saying, okay, what does that community look like in terms of low income, in terms of education, right? It's taking into account all of those factors. And so I think this makes it a little easier for us as we're determining low, medium, high priority, because we can factor in that SBI index. I think it's going to show here that it's a 59. So it's factoring that in there for us. And so that's what this scale means, is the closer to 1 it is, the higher that SBI is, and the more vulnerable that community is based off of those different socioeconomic factors. Does that make sense?
Yeah, perfect. Thank you.
Yeah. So yeah, let me just show a couple other layers here, and then we'll move on. So here I'm just focusing on the tobacco retail license. And so, like I said, that granular level is really nice because you can see there are quite a few retailers within a 1 block radius of this case. So that might be something you will want to explore. You'd want to do more outreach in, right? And so it's just kind of helpful to think through what are some different approaches that I can do based off of the layer information. Same thing with the properties without smoke-free policy, if you're wanting to do more with the affordable housing, right? So right now we've kind of included all of those layers. We don't know if we're gonna use them all collectively or one at a time in terms of like outreach, right? How we wanna go about like that individual level outreach, but we do have an approach for how we wanna prioritize and start ranking cases. So that's the next step here. So with that map, what we're hoping to do is we're going to take it into an Excel ranking, like a ranking Excel, I guess is what I want to call it. And so Wido did a really great job of developing this for us. And basically everything that kind of populates on the left-hand side of that map that I just showed, those numbers will be plugging into this Excel that'll automatically rank that case for us, right? And so based off of the number of air quality or air quality units, right, that we're seeing the particulate matter, we'll plug that in. The number of affordable housing within that 1 mile, half a mile, whatever the radius is, the number of cases, the number of social vulnerability index number, right? So I plug that in here. And so here you can see the screenshot. Everything gets placed into the layer that it's representing, so 15 tobacco retail licenses. And so the color just means if it's green, it's low. We ranked it as kind of a low tier. So each of these layers, we created a scale that was like 0 to 50 is low for air quality, and 0 to 25 for affordable housing is low, right? So we made those tiers ourselves. And so if it counts it as a low tier, then it'll make it green. If it's medium, it turns yellow. And then if it's high, then that's when it'll turn red. So just from this sample case that we're looking at, you can see the SVI and the tobacco retail licenses are probably the most concerning layers because we have a lot of tobacco retailers and the SVI is higher, right, for this specific case. And so that overall would rank it as a high priority case. And the reason that this is important is because we're hoping that this will inform our outreach approach. So depending on how those cases are ranked, then we would follow these processes that are outlined here. So for low priority, we're planning to do our current approach, reaching out to the housing provider via email and offering TA services. So signage, education, resources. If it's medium priority, then we want to do a bit more, right, than just reaching out via email. So we would want to also drop off that material and try to meet with a staff member and talk about the importance of what we're bringing to them, right? And maybe kind of start to plant that seed of, is this a policy you would consider adopting? How can we support you, right? With high priority cases where SVI is really high, maybe there's some air quality issues. We've got a ton of retailers. There's a huge concentration of cases, right? We're getting really serious cases. That's kind of what we would be thinking as a high priority. So in this case, we definitely want to be a little bit more intentional with our approach. So reaching out to the property, going in person, talking to a manager, talking about how can we help support you in policy adoption or enforcing your policy, right? Is that a policy gap analysis is one idea we had. So Wido has done a little bit of this with some of the providers he's worked with, but really it's just taking their policy and saying like, what are some opportunities for improvement? But that's kind of what we're thinking at this point in time. A lot of this is fluid, especially the process stuff that we're developing. We know that that's going to change. And as we start to apply this more in practice, we may be updating. But those are just kind of the walkthroughs, the videos. And like I said, you'll have access to those if you want to refer back to this recording or the video on your own time. And if you have questions, please feel free to reach out to us. But the use of this map and kind of the application, I think, goes beyond just kind of visualizing what's going on, but also like what can you do with that story that's being told, right? So mapping out the cases can influence internal decisions. Like in our case, it's already informing our internal procedures and policies, at least like in terms of SOPs, right? How we approach our work. It can also inform decision makers and their policy decisions. So big P policy in terms of city, countywide ordinances or code, right? It can also support organizations with their policies, whether that be adoption or enforcement. So here are a couple links that we will share in the chat. Wido, if you wouldn't mind popping those in the chat. The CDPHE open data homepage is where we got some of our layers. And really it's just to get an idea if you want to start exploring some of these layers. There are a lot of different layers on there. There are descriptions and examples of how these are used. And so that's where we pulled some of the layers that we pulled into our GIS map. The Google My Maps layer, just if you want to start playing around with building out a Google My Map. And like I said, that is private until you make it public. So feel free to play with it, change the icons, upload one case, see what that does, right? And then GASP resources. So I mentioned Pete and our partnership with him in terms of the properties without smoke-free policy. So definitely tap into resources from local partners as well. I think that's really beneficial when you don't have all the data and all the answers. So I think I went a little bit over, so I apologize for that, but we will go ahead and transition into a breakout activity now. And we've got a couple maps that we would like
Hey, Bianca.
for you. Yeah.
I'm wondering if in sake of time, I just want to make sure we do this. Maybe we stay in this room and do one map and just go through the questions.
Yeah.
And then we concentrate, and then we share that we do a bigger section in the training of this.
Okay.
How
Yeah,
do you
we
feel?
can.
How do you feel
Yeah,
about
we
that?
can pivot. Let me just pull up one of the maps here.
Yeah, pull up like the Mesa County map or Otero.
Okay.
We're going to have a section in our training on this. So we're going to have hands-on, time, an hour where we can sit and everybody can work together on this. Okay, Bianca.
Okay. So I'm trying to pull it up, but it's not letting me click out of screen sharing. I don't know why. Wido, would you mind placing that Otero County map in the chat, please? Thank you. Okay, there we go. Perfect. So let me screen share the Otero County one. All right. Peggy, can you see that okay?
Yes, ma'am.
Okay, perfect. So yes, like Peggy mentioned, originally we had 4 breakouts. So feel free to check out any of these maps, especially if it's closer to where your health department is localized. It's helpful. I'm not gonna lie, I use Copilot to pick these case samples because I'm not familiar with your counties. But that was really helpful. Like Copilot picked out a couple addresses for me, and then it made kind of that 4-column data Excel that I could upload into Google. And so that's what I did here with the Otero map as well. So I started with that county layer, like I showed in the video, and then I added the Otero County cases. And so here in this map specifically, the way that it's showing up now, it only shows the layer of the county and then the cases, right? But I mentioned that you can also use tobacco retailer data, and the reason for that, right? And so this tobacco retailer data for Otero County, I got from the track dashboard, the tobacco retail license dashboard that the state put together. And so you can download Excel files from that website and it'll pull, I think it pulls it across all counties. So you just have to filter out for your county. But that's what I did here. So it's interesting once you add that layer, right, of tobacco retailers, you start to see some alignment. So something to consider as we start to work through these questions. But this is what a sample map could look like, right? This is again using sample data. So as you're collecting data on cases, you can always import your case data making it anonymous, obviously, because you're still importing into Google, but you can change the case number, maybe the case details in terms of name, first name, last name. You can change that just to the case number, right? So it's more protected. But we have a couple questions that we wanted to go through. Let me see if I can put a screenshot of that in the chat. Not sure if it's gonna let me screenshot while I'm screen sharing. Hopefully this works. Okay, so I just put those in the chat here. And we can kind of work through those. So feel free to put your answers in the chat or come off mute. But the purpose of these maps, like I said, it's to develop them and start to make sense of them. So like, how are you interpreting what you're seeing in terms of data? What is the story that's being told? So these questions here kind of categorized by patterns, trends, right? What you're seeing in terms of where the data is falling, context and interpretation, and then policy and or impact and action. So just a couple questions to kind of think through. So one easy one is like, where are you seeing the most concentration of complaints in this map?
Hey, Bianca, we have a question in chat. Chelsea, would you like to come off mute and ask your question?
Sorry, it's more I don't know Microsoft Teams and I cannot find the chat. Can somebody put me in the right direction?
I see, yeah, I see 5 of you don't have Teams, so they can't see the chat. So would you mind just asking, like, just ask a couple questions? Like the first one would be like, where do you see concentration of secondhand smokes? What are the most complaints concentrated? And do you have, so the patterns and trends? Maybe just ask those couple of questions to see if we can see that.
Mm-hmm. Okay,
verbally.
yeah. So yeah, like the first question, I think a really good starting point is just kind of looking at the map and trying to figure out like, where are you seeing hotspots in your county? So like here for Otero County, there are a couple cases here. And then I think there are 3 up in this area. So, you know, you might start to think about why is that? And maybe I think we had a few folks from Otero County who may be more familiar with these intersections. There could be more of a story right in the community that's happening as to why there are potentially three complaints in this area. So I don't know if anyone from Otero County has additional insights that they'd like to share. We can also take a look at the tobacco retail licenses around those 3 cases as well. So, I mean, just even within these 3 cases, there's about 8, if I'm counting correctly, 7 cases, 7 retailers, right? So just within the 3 complaints, there are 8 tobacco retailers. So that tells some part of the story as well, right? So any initial thoughts, insights?
It looks like when you had it zoomed out, it looked like they're all along that one highway. Like all the housing was along 50, but now I see it's like a secondary road there. And I think this is really interesting to develop it to your area, because let's say it's Boulder, where they have a really high student population, you know, like that, to me, that would be a layer I would use, like, you know, students exposed to secondhand smoke. So making these, you know, to your own. So Bianca, I'm going to say thank you to now, and I'm going to close up with everyone and say that this is high level. Bianca, I know you I work with you, so I know how much work you put into this. And she also had help from our GS team, and not everyone has that. So again, this is the high level end product, but we want you to start thinking about those, first of all, the breakout questions. And I'm going to upload this recording to Tobacco Free Colorado. But if this work interests you, Bianca's going to be joining our TA team as support next year. So she's going to be able to help offer TA on these processes to get you started, whether rude, Google Maps, small, start, but help you with that. So we're going to walk you through these things. We're going to have an excellent training March the 31st in Douglas County, and we're going to have a section focused on this. We're going to work together in the room and create our maps. One thing that I do want you all to consider and start talking with your teams is the possibility of adding the strategy of secondhand smoke-free housing to your grants next year when you're selecting your strategies. If you want to do work like this, you'll want to have the ability to do it, and that would mean you would need to be funded under the strategy. So consider talking with your team about the strategy, and that would give you the time and the capacity to be able to do work like this and further that work. I want to say thanks to everyone who came today, and give just a moment for anyone to have any questions or comments before we sign off.
I also
this is Pete. I just want to mention to those people, we do keep a database of all apartments and condos in Colorado. It's not all up to date, but from all the surveying we did, we can not only provide you with a list of those that are smoke-free, but those that we have found not to be smoke-free, or those that we weren't even able to reach to find out what policy they had. And we can provide all that information to your district by city or by county when you need it. So if you want that information, just get in touch with me, and I'm happy to do that for you.
I think that's a great base layer too, that first layer with Pete's information. That'll get you started. So I do encourage everyone, if you're not in a strategy, at least start with that base layer of your housing inventory.
Yeah, that's what I was going to add too. So you don't just have to map cases. It could be housing properties. So I know Peggy and I talked about even doing like a housing inventory map rather than complaint based. That could still inform outreach efforts. So definitely something to consider, and lean on local partners like Pete for that info. And then I did pop Wido and Maya's email in the chat. So please feel free to reach out. It's been a learning process for us, and we're happy to share any of our lessons learned or walk you through Google My Maps, whatever's helpful.
Yeah. Well, thank you, Bianca, and thank you, Wido. Thanks to the Denver team for presenting this and for all the hard work you've done. And we look forward to, as we move into model ordinance, if you sit there and if you've ever gone through a policy with your city council, you'll know they want to see these things. They want to see the impact. They want to see the story. So this is just the beginning of a very long process, but we want to get you started. So thanks so much for coming today. Enjoy your day and your weekend ahead. And I will be posting this up so you can rewatch it and understand it better. Thanks for coming today. Bye-bye.
Did you want us to stay on, Peggy, or are you good?
Stay on a minute, yeah.
Okay. You pieced out. We don't have
off. Yeah.
So,
yeah. Thank you. I never know how much the introductions are going to go, but Raya said that's a really important.
Oh yeah.
That's
I just admitted him.
Okay.
Yeah, I remember you saying that Raya liked the introduction.
Let me stop the recording. I'm going to stop it. Okay, perfect. Yeah,